So today we are going to look at that first section that's listed in the exam outline, which is our purpose and technique. And this section is worth 50% of the exam, so it's a large chunk of those questions that you may be seeing that are related to purpose and technique when it comes to radiation health and safety. So the purpose and technique section is larger. We're going to split it into two sessions. So today we are going to look at landmark, condition, and material identification. We're going to look at the purpose of dental images. We're going to review our image viewing and mounting, and we're going to review our legal requirements for image maintenance. I will have another session that is available that will look at the other items that are in this purpose and technique section. So please be on the lookout for that if you are wanting information on any of these other items. All right, so let's start with the different types of exams that we can have in radiography. So first we're going to talk about intraoral examinations. And it's important as we walk through these that you understand some of the terminology that we're using so we can all talk about these things and understand each other. So intraoral means inside the mouth. So these are our radiographic exams that are taken with our receptors inside the mouth. And the first one we have is a periapical radiograph. And you'll often hear to these referred to as a PA radiograph or simply a PA. Periapical radiograph, if we break that word down, peri means around, apex means the root tip. So these radiographic exams will give us an image of both the tooth crown and the tooth root, plus all of that surrounding alveolar bone. So we're looking at the structures that are around the root tip. Our next radiographic exam is an interproximal radiograph. And the term interproximal means between the teeth. So when we look at these radiographs, we are looking for the crowns of both arches, the maxillary and mandibular arch, and we're looking at those interproximal spaces. These are often referred to as bite wing radiographs because when we expose them, oftentimes there is a little cardboard tab on the side of it that we bite down on, and it looks like a little wing sticking out off of the receptor. So you may hear these referred to as a bite wing. Our last intraoral exam is an occlusal radiograph. And an occlusal radiograph shows us the large area of the maxilla or the mandibular arch. When we look at occlusal radiographs, these are good for our younger patients who are maybe not able to handle a PA or a bite wing. And we have the patient actually bite down on a receptor, almost like a cracker. So for our smaller patients or more pediatric patients, using like a size 2 film would be plenty, and they can close down on it like a cracker, and you can get a large area of their maxillary or mandibular arch on that radiograph. This is good for things like trauma, for things like looking for impacted teeth on little ones. And so we can use it for some different identification than we would be using a bite wing or a PA for. When we put our intraoral exams together, so we've got our PAs and our bite wings, we put them all together into one nice series. This is called a full mouth series. And this full mouth series includes all of the teeth in a person's mouth. So we've got periapical images of our maxillary teeth all the way across. We've got periapical images of our mandibular teeth all the way across, and we've got bite wings in the middle. Now, those bite wings are used to look for interproximal caries or cavities. So we need those in addition to the PAs, the periapicals, because periapicals are looking for that root structure and the surrounding tissue, and may not always show the interproximal view that we can get in a bite wing to look for caries. So our radiographs are serving different purposes, but they all fit together nicely into this full mouse series. Now, a standard full mouse series will have 18 radiographs in it. There are 4 posterior radiographs on each side. Those are our back teeth. We have 6 anterior radiographs. Those are our front teeth. And then we have 4 bite wing radiographs, 2 on the left and 2 on the right. In addition to our intraoral radiographs, or radiographs that are taken inside the mouth, we also have what are called extraoral examinations. And extraoral means outside the oral cavity. So these radiographic exams are taken on receptors that are outside of the oral cavity. The most common one you'll see is a panoramic radiograph, which is the larger picture on this slide. Now, a panoramic radiograph, it takes the full view of a person's maxilla and mandible and flattens it out. So we can look at it in a 2-dimensional picture. And because we have taken our 3-dimensional oral cavity and flattened it into a 2-dimensional picture, there is some distortion in what is going on in this picture. Panoramic radiographs are great for looking at the mandible and maxilla, looking for trauma, looking for impacted teeth that may not be visible in other radiographs like wisdom teeth, and can show a lot of different conditions. Panoramic radiographs are not great for identifying and diagnosing caries or cavities. And you should not use a panoramic radiograph to replace a bite wing radiograph when we're looking for caries. You can also find a lot of other different types of extraoral exams that may not be as common, especially in general practice. There are things like a cephalometric radiograph. These are often used in orthodontics. A cephalometric radiograph is a side view of the head, and you can see the entire skull, maxilla, mandible. You can see the soft tissue in there, the patient's nose, their lips, and this can be used for orthodontic treatment planning. We also have a submento vertex radiograph. So this radiograph is actually exposed from underneath the chin. So you can see in that middle smaller picture there, you can see the mandible, the shape of the mandible, and kind of the bottom of the skull. The next extraoral exam I have on here is called a postero-anterior radiograph. And this radiograph is actually exposed from the back of the patient's head. So the receptor is in front of their face, and you're taking the x-ray from the back of their head. Once again, this is a less common radiograph, but you may see it in like some oral surgery procedures, orthodontic treatment planning, some more complex things that we probably are not going to be doing in general practice.